Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the episode for you today? You guys already know that I tell y'all therapy changed my life. During my divorce, after my surgery, therapy changed my life. And I've told y'all 100 times on this show how much growth happened and how I still continue to try to grow. Well, our guest today is perfect for this show. So I have Dr. Alan Goodwin. He is a licensed psychologist out of LA. He's a speaker, educator, and author of the book Saving Face Without Losing Your Mind, Bringing Psychological Wellness to Your Cosmetic Procedure. I know, I can hear y'all gasp. Beautiful. So thank you so much for being with us, Dr. Goodwin.
It's really my pleasure. I'm really looking forward to this talk.
We on this show are really open about our experiences with surgery. And one of those experiences that for me, I was always open about is the emotional roller coaster that you go through during your recovery and through your whole journey. Like, am I doing the right thing? What about this? What about that? So many worries and anxieties. And I feel like in your book, you put it so nicely. And I can't wait for my girls to hear from you. But first, I have a question. So when I was reading your bio, it said you were a lawyer and then you turned into a psychologist. So what happened? Why did you switch?
You would think they're really different careers, and in a sense they are. But when you become a lawyer, there really are a lot of people who go into law to help people. And you can do some really great work for people. But the more I was doing it, the more I probably shouldn't go too much into it because it'll take up time. But I was taking a deposition, and there was one day when I was taking this deposition of a woman who her husband, who was gone, he had taken off with another woman. He didn't maintain the property that we were suing appropriately. And we didn't have any records, and we couldn't find him because he took off. And I was deposing her, and I could see how much pain she was in, even a couple of years after this guy had left. And I was aware that as I was talking with her, I have my job. My job is about finding records and finding out, about the property. But I was a lot more distracted and interested in how she was doing and why she was still in so much pain. And I remember leaving that deposition and talking to my therapist at that time about, maybe I'm really not in the right work. Maybe this is really the time for me to look at switching. And I knew if I waited too long, I wouldn't do it. So right then I started the transition, and that's the story.
Wow. What a cool story. So you saw her pain and you were like, wow, this is really interesting. I have to switch.
Yeah, you can help people as a lawyer for sure, but you're not going to be doing therapy. And what's really cool every day, I've been doing it for, 25 years. I started when I was 4, Mommy. but seriously, like every day you are exploring, really private and really interesting stories, life stories with people. And it's awesome what you can do for people. It's really powerful.
So, Dr. Goodwin, I'm going to call you Alan because earlier you told me to call you Alan. Alan,
Great.
Tell us, in your experience, what is something that you would tell my girls, our listeners, that would benefit them as they start in their journey to look for cosmetic surgery or during their recovery, wherever they are now listening, if they're in recovery or just starting? What is something that you think could help them?
I think what I would start with is really what I'm drawn to in the type of therapy that I do, which is really mindfulness based. So there's a lot of Eastern ideas that are integrated in it, is that compassion is just so powerful. And if you think of compassion as seeing a person within the context of their struggle, It's really about honoring that we are all struggling all the time. Life is difficult. There's a lot of joy in life, but there's struggle all the time. And if you accept that, if you embrace that, you cope with the struggle a lot better. You know, after surgery, you were alluding to how we can do all kinds of stuff to ourselves in the recovery phase because of the uncertainty and, our fears about what could happen. All of that is made more difficult if you're feeling physical discomfort, which you're going to be feeling. So you're already in a more vulnerable state because you're feeling vulnerable. So it's such an important thing to get in practice and learn ways to nurture yourself, to take care of yourself. We talk about body dysmorphic disorder sometimes, and, that's a diagnosis. Really, what it's about is not feeling okay about yourself. And we can say, well, if I switch that, then I'll feel better. And there may be truth to that. But the problem is, if we're talking really about a problem, about dysmorphia, the problem is whatever is put on me is going to get attached to me. And that's why I'm rejecting it. That's what we work on in therapy. So a lot of the time in therapy, so like no change, no physical change is going to fix that. That's why a lot of the time in therapy, the focus is on, are you really taking care of yourself? Are you really caring about yourself? Are you really knowing how to nurture yourself? And that's where the mindfulness enters in, really holding a mirror up in a really caring, compassionate way so someone can really look at how they've been treating themselves.
That is beautiful. Yesterday, actually, I had an interview with Teresa from Transforming Teresa Marie. And she was actually mentioning to me that she was 600 pounds at one point in her life, and that there was a doctor who came to talk to her, and that this cardiologist asked her, why are you doing this to yourself? And she said that she didn't know how or why, but that got through to her and it made her snap out of it. Why am I doing this to myself? This topic makes me so excited because I know that with this episode, my girls who are listening are going to learn something and they're going to take it with them in their journey, and it's going to help their recovery better. Mindfulness to me is something so important. I practice it every day. That's why you guys on my Instagram, you'll see me on my finger that every day I write gratitude, because I want to remind myself how lucky, how blessed, how amazing everything around me is. And I'm just happy to be here.
That's awesome.
So,
and that's a great example of a really powerful tool. It's easy to say, be grateful, but it's really helpful just to be clearer, about why would gratitude work? Why would that kind of work be helpful to somebody? And it's because, we can feel pieces of depression. Depression is a form of sadness. And when we struggle with that, with sadness, we're really struggling with, I don't feel like I have enough, or I've lost something really important to me. And if you think about it that way, gratitude work directly addresses that. It doesn't deny the loss. It doesn't deny the pain of the absence of something that I'd really like in my life. But it reminds me that that's not the whole picture. There's other stuff in the picture that I do like, that I'm happy with, that I'm grateful for. So it's really about perspective. And really good therapy, a lot of it is just about that. It's not rocket science. It's just about really doing what you need to do to regain a sense of perspective.
Alan, on this show, I talk about going to therapy. And one of the things that I've mentioned is how when I was going to therapy, I was afraid of telling people because I didn't want them to think I was crazy, but I knew I wasn't crazy. And I feel like that's something that a lot of people think. They don't want, because of our society, they don't want to be like, oh, you're crazy, you're going to see a therapist. But can you tell my girls, what is it? What happens during therapy? What does a good therapy session look like?
Yeah, that's a great question and really important. I love getting clients who have never been to therapy. And I especially love having clients who are skeptical about therapy, because I was. I went into law. I thought psychotherapy a lot of it was nonsense. And I still do. but good therapy isn't. And good therapy is really what we do in therapy. We've stolen from other fields and cultures. I mean, you look at the stuff that we do in Western psychotherapy, and you can find roots of it, in cultures in Greece, in cultures, in the Far East, going back thousands of years. So the cognitive part of the work, it's just about accurate thinking. It's about reasonable thinking. It's about being fair with yourself, not making more of things than are really there. And stuff like your grandmother, your grandfather, your parents might have said to you, or in your stronger times, you say to yourself. So that's part of the work. The other part of the work is really being clear about what behaviors are constructive for you and what are destructive. And of course, now we're talking about, what you eat, what you drink, how you behave, how much sleep you get, health-related behaviors. That really is what cognitive behavioral therapy is about. It's about setting up a way of living that's healthy for you. And I've always thought that a lot of psychologists and other mental health professionals don't do a service when they appear to be somebody who could never have the problems that their clients have. I think it's important for my clients' issues to be filling the room. And that's what happens in therapy. But there's space for me to be letting them know, I've struggled too. And I even still struggle with certain things. I'm not making the hour about me, but I'm letting them know that, struggle is about being human, involves struggling. It's a part of life. And so I think humanizing this stuff and not thinking of it as a form of weakness is very important.
Do you see an increase in traffic since the pandemic? Have you seen an increase in traffic through your office?
Oh, for sure. Yeah. All mental health professionals are seeing it. I mean, if you think about it, there's been there's all sorts of things going on that are destabilizing for people. There's world affairs for sure. There's just the health issue, the pandemic. It's really had an impact in so many ways. Socially, how much of an impact that's had. And that's really heightened the impact of the health piece of it because we don't get the distractions. We don't get access to the healthy distractions still that we had before. We still really haven't recovered in that sense. So yeah, there's a lot of anxiety and a lot of, levels of depression. Depression, like I said, is sadness. Anxiety is fear. So yeah, there's whether it's diagnosable level or not, doesn't really matter. There's plenty of fear and plenty of sadness out there.
Absolutely. So during mindfulness, I know you also talk in your book about meditation. So if y'all saw me on TikTok and y'all saw this, on Instagram, y'all saw me post this video and it's like me trying to meditate, but in my head, I'm singing. I'm like, So tell us about meditation and how do you meditate?
I have a series of 4 TikTok videos that are TikTok, so they're like a minute each. And the title of them is Why You Suck at Meditating. And I made them because everybody says that. If I suggest meditation to a client, 9 out of 10 times they say, yeah, I tried it. It's not for me. I have too active of mind. So meditation is not about silencing your mind. That's the first thing I tell clients. The problem with things like the Calm app is it gives the impression to people that that's the first thing that happens. That's the long-term objective, and it's a great objective. But you get to that calmness after you've already worked through all of the tumult that you feel when you try to sit with yourself. So ultimately, that's what meditation is. It's staying present with yourself. And related to this, I talk with clients about the concept of tripping. Like a vacation, we can say that we trip in all sorts of ways. He was tripping on his anger, he's tripping on his sadness. We can trip on a drug. Tripping is a great term because it's a reference to the idea that in my mind, I'm not totally present right now. I'm consumed by something. And any compulsive activity, like substance use, if it's a problem, it's a compulsive activity. I feel compelled to go to it. So I could have a sex addiction, feel compelled to do that. I could be somebody who is worrying all the time, and that's like a compulsive activity. Anything I'm doing compulsively, I'm tripping on, and I'm not present. So that's why meditation is, in our day and age, such a powerful tool. It's always been, but we have so many distractions. Distractions can be good, but distractions can become a source of a compulsive activity. And so what meditation is ultimately is about staying present with yourself. And it creates, the Buddhists talk about creating space in your mind. One way to think of it psychologically is space between stimuli and our reactions to those stimuli. So a stimuli is anything, something that I see, something I smell, something I think, something that happens in my world. We get so used to reacting. We instantly react. And the more nervous we are, the more quickly we react. Meditation gives you practice noticing the stimulus and sitting for even just a second or two and choosing your reaction. Does that make sense?
Absolutely. So I totally understand this reactive energy that we kind of carry around with us. I'm still learning.
It's hard not to be that way. I mean, it's the fight flight thing. We're like squirrels in the forest, We feel safer if we're really hyper alert. And people who have been traumatized, that's why one of the characteristics is hyper vigilance, noticing what's around you all the time because it feels safer.
What about when you don't notice anything? Like me, I walk around and I don't notice anything.
Well, I mean, in a sense, that can be a good thing because at least you're not in that hypervigilant state, which is about really, really high anxiety. But, the opposite can be true too. If I'm not commenting on you now, I don't know you, but some people could be walking around and denying their reality because they're still afraid. They're just dealing with the fear in a different way. So that's why the whole idea of therapy and mindfulness and meditation it's about empowerment. It's about, recognizing that you can sit in your reality and be present with it. There's a joke. What did the Zen Buddhist say to the hot dog salesman? Make me one with everything. Because Buddhists are ultimately trying to recognize and really internalize that you and me and the plant and the door and everything around us, we are all ultimately the same. We're all made up of, whatever, nitrogen, oxygen, whatever. And we're all just trying to get through this life. And you can see how that way of thinking, if you really internalize it, it's a really compassionate way of being. If you start thinking that way, then you recognize, oh yeah, the people who wronged me, they're struggling. And maybe I don't want to be near them because they're unhealthy and it's not safe to be around them. But if I see their struggle, I can take what they do to me a little less personally. It's not so much about me. Does that make sense?
It's beautiful. This is beautiful because it makes me think of like when they tell you when somebody's being mean to you or somebody's doing you wrong, it's not so much about you, but it's about them.
Yeah, definitely. And it's hard because someone will say, well, what do you mean don't take it personally? They did it to me. The point is that on a deep level, when we take it personally, there's this offense inside us, which is understandable. Like, I didn't deserve that. And you're right. But that's what's powerful about not personalizing it. They're really not doing it because of you. It's a reflection of their state, and it's very important because people do get in abusive situations. It's really important to say along with this, you may not want to put yourself in the position of being exposed to that person's behavior.
When you sent your podcast prep sheet, I always ask 5 things that you would like our audience to know. And your 5 things are so perfect. I'm going to read one, and then I want you to tell us why you choose that. So the first one is people can change.
Yeah, it's just the core of what we do in therapy. A lot of people avoid therapy because they really don't believe they can. And some people, I think deep down are fearing that they're going to learn that's going to be confirmed. I always think it's important in talking with people about therapy to say, the first therapist you work with, the second, the third, they may not be the right one. Not every therapist is going to be helpful to everyone that they work with. And so sometimes you have to find another one. And there are really a lot of people who give up because of that. So you definitely can change. It's complicated why we become the way that we are. But what I love about the work that I do is you really can figure out what the puzzle's about. We're puzzles, and there really are answers. We can't solve every problem, but we can understand, where the problem came from, and that helps us cope. One of the ways that I don't follow things that a lot of Buddhists say is you hear Buddhists say life is suffering. Inevitably, life is about suffering. I don't think that's as helpful as saying life inevitably struggles to us. I think it's the people who reject that struggling is an inevitable part of life. Those are the people who really suffer. And so we can manage our suffering by embracing the reality that life is a challenge, that we're presented with challenges all the time. And it's understandable to struggle sometimes.
Absolutely. Okay. And the second one you had was people can learn to manage their emotions.
Yeah, for sure. That's another one of those things that a lot of people just come to accept, but that's because they really haven't worked on it. They really haven't worked on developing some ways of understanding where their emotions are coming from. The core of the work in any therapy really is that the way that you feel, your emotions, are a function of how you're thinking and how you're behaving. That's what cognitive behavioral therapy is about. But really, that's what all effective therapy deals with, that you can change the way that you're thinking about yourself, about other people, about your life, and that will have a direct effect on how you're feeling. And then there are practices like meditation and just other health-related practices that directly affect how you feel. And so, sure, it's really an important part of empowering someone to reassure them that you can change.
The next one you have here is meditation really can help you cope in life.
Yeah, I mean, I was one of those people that thought meditation just seemed like nonsense. It just seemed like an escape. When I first heard about meditation, I thought, I don't have anything against those people, but it's not going to solve any problems. And now I understand how, slowing yourself down and just being present and coming back from the trips, just staying with yourself can be a really powerful way of coping. And it can, the people who meditate over long periods of time talk about developing much more of a groundedness within themselves. That doesn't mean they don't struggle. It just means that they accept the struggle and cope with the struggle better. And that helps us get to the point of joy despite the struggle much more often.
Absolutely. I have something I want to say and insert my little story on this one, but let's go on to number 4.
You sure?
Yeah. You know what? I was going to say that I learned to be nicer to myself in my self-talk. I was very hard on myself. Like, you can do better. Like, don't be lazy. Get up. Like, I'm very hard on myself. And learning with meditation, like, I have learned to be a lot nicer to myself. Like, even this morning, I put a lot of pressure on myself. Like, I have to be doing something. Like, I have to be doing something. And then I have to talk myself back. Like, no, it's fine. You are doing something. You're already. And just being nicer to myself the way I'm nice to everybody else around me, being nice to me.
Yeah, that's great. That is really, really powerful. And it raises the question, the complicated question, why do we treat ourselves that way sometimes? Some people treat themselves that way all the time. That can be complicated. A lot of people really don't feel hopeful that they can grow and change and succeed in a way that they feel good about. Did we talk earlier about body dysmorphic disorder?
We touched on it a little bit, but you go for it, because I know how body dysmorphic disorder is very important in what we're talking about in the plastic surgery community.
Yeah, I think I mentioned this to you, but I talked with a different podcast earlier. So you stop me if I already said this. But what I'm thinking about right now is just the idea that, the core of that is how we feel about ourselves and how we can become rejecting of everything that we connect to ourselves. And that's one of the things that you look at in effective therapy. Why did you ever start treating yourself that way? I don't think I talked with you about the inner child, but the inner child idea is something that's used in therapy a lot. It's talked about in a kind of vague way a lot of the time, just the idea that you can have a vulnerable part inside of you that's like a child. That's not the way that I use it with clients. The way that I use it is, there's that vulnerable part of you, but it is you. It's the child that you were. The idea behind the inner child is that, we don't swap our brains out when we get to a certain age. We still have the brain we had when we were 5. And certain things we learn to think at 5 can get reactivated when we're 25 and 35 and 45 and have much more life experience and much more wisdom. And so those ways of thinking that worked for the 5-year-old that knew so little about themselves and about the world really don't work for the 25, 35, 45-year-old. And so the inner child idea, the way that I use it with clients, is to say, this is a way for you, if you're mindful, to separate yourself from some reactions that you're having, like failure or not getting things done, like what you were just talking about. That could be something that came to mean to you confirmation. Yeah, I'm just stupid. Or yeah, I'm just lazier than other people, or whatever oversimplification you use to beat yourself up. That's a good example of something that we could identify. You started doing this a long time ago when you were a kid. And
it's my mom's fault.
Well, the problem is definitely, you're kidding, but definitely parents and other people in our life can have an influence. But the problem is the 5-year-old doesn't have the life experience to recognize that that's not accurate. And in that moment now as an adult, we can step back again, mindfully, and we can say, wait a minute, I don't believe that. That really isn't true. I'm not always lazy. So we can cut short those abusive tendencies that can just become a part of the way we are toward ourselves if we don't ever really stop and look at it.
If we don't ever get it in check.
Yep.
Okay, so that leads us to your concerns are valid and real.
Yeah, you have to honor yourself. You have to honor what your questions are, what your concerns are. And listen, some physicians are better than others at respecting those and being available to hear them. I really feel like one of the ways that we can make a real positive change for patients is to encourage support groups to crop up. What I've heard from clients is that they really benefit when they can sit in a room with other people who are preparing for a procedure or have had a procedure, a combination of both, are at different stages in their recovery process, and can have conversations that help them feel like their concerns and their fears are valid. Because, some physicians really don't react in a way that gives you that impression. They don't want to hear the questions. And I always tell clients, if you're really concerned about talking openly with your doctor, you really need to look very carefully at whether you found the right doctor. Sometimes that's coming from the patient. They're just, in general, they have trouble being more, forthright
Absolutely.
with their concerns.
Absolutely.
Yeah.
On this show, I always tell my girls that I want them to see at least 3 consultations. It's like, this person's going to cut you open. We got to make sure we are on the same page. We have a connection. You understand that this doctor is going to provide the best care for you and take care of you after surgery. So these are all things that are super important when you're looking for your surgeon. So
yeah,
that leaves us the last one, which I think you touched a little bit, was honor the process.
Yeah. We should say there are also gender pieces to this. What I was saying a minute ago about your concerns being valid, that can come up. It can come up that women are socialized a lot of the time to doubt their concerns or to not give voice to their concerns. So trusting and self-respect, it's just such an important part of it. So, that's a really empowering idea. Just recognizing that, you can grow through this process. And, we talk in therapy about curiosity because it's really hard to change and grow if you're beating yourself up. It's really hard to be curious if you're committed to punishing. And so I encourage clients to really question themselves about that. And I don't believe you can do both. But in any event, I think you have to tone down the punishment and get to the curiosity, because that's really what's going to help you recognize that there is a process, there is a growth process.
You know, I have a question for you. What were you
Sure.
seeing in practice that made you write this book? Because before I found your book, like just from what I was seeing in being a medical assistant and patient coordinator for plastic surgeons, I was seeing the women's journey from start to finish. And when I left the office, I realized I missed that. And what was it? It was walking them through their journey of their plastic surgery and seeing them come out on the other side. So when I read your book, I was like, oh my God, this is exactly what I've been talking about.
Yeah, that's cool. Yeah. No, I mean, I think so many people go through that process and go through a lot of other journeys throughout their life without really getting the help that they need to understand what this is about for them. And so I just think I saw that over and over again. And, you know, I know some plastic surgeons, and that contributed to some of the referrals initially, just casual conversations like, you should have seen what I did for him or her. And it just seemed like nothing made them happy. They weren't I couldn't satisfy them. I would hear from the doctor. And it understandably didn't occur to the doctor that, you know, the patient a lot of the time really doesn't even themselves recognize that they have an agenda that is self-sabotaging. And so the doctor really doesn't have much of a chance. The patient doesn't have much of a chance unless they recognize that, you know. And so I saw that. I think I say this on the cover of the book, one of the pockets of the book, that I just saw that there weren't resources out there for clients. And I refer clients to resources all the time. And so that's why ultimately I thought, you know, I've got something to say on this and I should just do it.
I'm so happy you did. It's a great book. Okay, so I don't want to take up too much more of your time, but I have 2 questions for you before I let you go that I think would really help my girls. The first one is, when somebody is deciding to have surgery, I know I've been there myself. I've talked to hundreds of women who have been in the same position. Am I making the right decision? That's what they ask themselves. Like, am I doing the right thing? So how do you help, or what would you tell somebody who's considering a plastic surgery procedure and they don't know if it's the right decision for them, or they want to know?
Yeah, I think it's just a really important question. And I do think it's different for everybody. But I think one question to ask yourself is, why are you doing it? Who is it for? Is it only for you? What's the objective? Is it realistic? Is it healthy? Is it coming from a place of strength? You know, we want to be mindful of when we're acting in life in general from a place of fear. That's not a good place to make decisions from. Sometimes it is, but we don't want to be guided in life all the time just by fear. And so I think it's just an individual decision. And what you said is talking to more than one doctor is important. Get more than one opinion. People in your life who you care about, having people that you can talk with about it. I think it's really helpful to bring someone to your appointment with the physician, because that can help you ask all the questions that you want to ask. It's hard to know.
Yeah, it is hard. It is hard. And I always tell my girls, as long as you feel within you that you're making the right decision for yourself, you're not hurting anybody and you're not putting anybody in danger, and you've done your homework, you've done your research, you know you're going to a establishment that's going to take care of you. That's, for me, what I tell my girls. But everybody has a different view, right? As far as risks. Risks, we know, are always going to be there for any plastic surgery or any procedure every day in our daily life. Risk is part of living. We encounter them every day. So understanding the risks of the procedure that you are choosing is very important, in my opinion. Understanding the risk and understanding the whole recovery of a procedure. So many times I've had women who come and they are going to have a tummy tuck and they want it tomorrow or next week, and they have they just decided they wanted to do this a couple days ago, and now they're ready to do it, and they have really no idea what they're getting themselves into. So understanding the surgery journey, the risks that are involved, both of those things, and making sure that you're doing it for yourself and for nobody else. Those for me are the top three.
That's great. And I would say, one thought experiment people can do is try to get a sense of how you treat things that you acquire. Like, I don't know if this will sound strange to you, but it really isn't unusual for people to say something like, I tend to really like things and then get them. And then once I have them, once I own them, they don't feel as special to me. And I think that's a good thing to be thinking about in the context of what we're talking about, because I think that kind of thing happens in cosmetic procedures to some people, that like they want the change, but once the change is attached to them, it doesn't quite look the same. And I think you have to be ready for that, because if you're not, that really can fuel the, endless cosmetic procedures searching for something that you're really not going to find, because it's about what meaning you attach to the things that are attached to you.
Well, that leads us into the next question, which was, how can people learn to cope with results that they did not want?
Yeah, I mean, that's what I think when I think of the other question that we were talking about, which is the process. How do we honor the process? I think you really have to honor the decision that you made, and there's uncertainty in it. And I think you have to be really honest with yourself about what your dissatisfaction is, because the fact is, it's really very difficult to tease apart what's going on. Is this that I don't like the way this or that, whatever was worked on looks because the doctor just didn't do what we planned on? Or is it something different, something having to do with me and how I tend to look at myself? And an alternative to that is to really honor that, it's a really courageous decision to do it. And do I have to fix this? Can I give myself some time to just be with this before I decide that it really needs to be fixed? Because what can happen is, and I know you talk about this with people all the time. There's a period of swelling that takes, a while, and you never know for one person to the next how long that's going to take. And you need a tool. You need a set of tools within yourself to cope with the uncertainty. And I think part of that can be, whatever happens, I need to keep returning to, it was really courageous of me to make this decision, to go forward and do this. I really care about myself. I really like myself. And I'm going to deal with this. Whatever happens, I'll be okay.
I love it. You will be okay. Everything's going to be fine. So with that, what is something that our girls can do to build their confidence if they decide to have surgery or not? What are some things, skills that you can recommend for our girls to build their confidence?
I think it's about what you believe contributes to your confidence. What do you really respect about yourself and other people? What do you consider to be really important to you? And I think this is where people can lose their way. We have to come to really like ourselves. There's this irony that if you read the book, you saw it. I talk about at one point in the book, that the irony that if you're going to succeed in changing yourself in some way, you have to start by accepting yourself. And it's kind of a crazy thing to think about. I don't accept. That's why I want to change. But in order to change, we have to make a commitment. And ultimately, it's a commitment to ourselves. So we really have to be caring for ourselves. And a lot of people really aren't aware of how unkind they are to themselves, how unnurturing they are. So I think that's really an important part of the therapy. And in getting to know yourself and getting to know how you treat yourself well and when you don't, and why and where that comes from, those are the things that we work on if the therapy is effective. And you can totally change those things permanently in a really positive, empowering way. And then you'll be able to make those decisions from a place of strength, not from a place of like fear a place of like dependency, a sense of a dependency on other people's acceptance and approval. And with social media, that's just become so much more powerful now. How much of an impact the way other people receive us has on us. And it's human to be impacted somewhat, but that can really take over in an unhealthy way. And that can impact how you feel about what needs to change in me, you know?
Absolutely. I had one more question. In what I was reading for your information, you talked about how surgery triggers things that were already there. Can you tell us a little bit more about that?
It's just about that vulnerability in you. Everything psychological, the struggles that we have, the insecurities, whatever, those are all more difficult to deal with if you're in pain. And one of the problems with the recovery process, one of the things that makes it difficult, and the reason why it's really helpful to try to prepare ahead of time, is when you're in a physically vulnerable state, when you feel pain, physical pain, discomfort, it's more difficult to deal with the psychological stuff like uncertainty, self-esteem. What's wrong with me? Why am I so dependent? Why am I so reactive? Why can't I really believe in myself? All that stuff can get triggered and activated. One of the things I talk about with clients is you can think of life as, the struggle of life I was talking about before. You can think of that as like the stressors and the struggles in life are like open flames. We're going to run into open flames all the time. People who are rude to us, failures, things we don't do well that we want to do better, all sorts of things that are unpleasant. But it's up to us how flammable we are. We have control over that. We don't have control over whether we're going to bump into the flames. But if we nurture ourselves the right way, if we respect and love ourselves, we're not as flammable.
I love that. I knew this episode was going to be so good.
That's awesome.
I've been excited and waiting to talk with you today for weeks. And I'm so glad I did, because this is a topic that's very important to me and to my girls, to our community. So if any of them want to come see you, or if they want to book a consultation with you, how can they find you?
I've got a website. I've also got a TikTok channel and Instagram page. And so people can find me that way. I can consult if they're outside of California in a coaching way, but couldn't do therapy with them unless they're in California. But, now we do therapy, we do teletherapy. And so anywhere in California, I could work with someone.
Awesome.
But I would also say, the message that I really want to communicate to people is there's a lot of really effective therapy out there. And so find a therapist near you. And if the one you found wasn't so helpful, find another one. There really are so many of us. You really can change and grow and cope effectively with these kinds of things.
And be happy. You guys, let me tell y'all, since therapy, my life changed. I'm going to cry. Y'all know I'm such a crier. My life changed with therapy. Like the way I appreciate my day to day, the way I appreciate my kids, the way, even though I have failures and I get doors shut every day, I'm so happy. Like I just feel like this happiness with just laying in the bed with my kids and holding them and like having them next to me and just breathing in, like they're healthy, they're happy, I'm here, I'm healthy, I'm alive. Like just this gratitude. I swear to God, I say it all the time now. Like, I'm just happy to be here. I'm just happy to be here everywhere, wherever I go, whatever I'm doing. I'm just happy that I get to experience whatever it is that I'm doing. If I'm eating something really good, if I'm watching something, if I'm experiencing something new with my kids for the first time, like, my life changed. And because of that, I was able to build the confidence that I needed to launch this podcast. Because before that, it wasn't that I didn't have all the information and the knowledge to like get this podcast together, but I didn't have the confidence. I didn't believe in myself. Like, why are they going to listen to me? What do I have to say? And it was through self-work that I was able to break through all of that and believe in myself and believe that I do have something important to say and that I do have something that can help the community that can help women around the world. And none of this today, we wouldn't be here talking if it hadn't been for that. Me going through therapy and learning how to love myself and how to believe in me. And I want I want that for every single one of them. I want that for every single one of you.
I think it's so powerful that you share that. In the book, there are client stories that I describe. And one of the things that was really important to me is to always do that in a really respectful way. There's humor, but it's never making fun of the client. And that's because I just think one of the problems people struggle with is we do go through periods of pain because there are people who will doubt us no matter what we have to offer. They're going to be out there. And so what's so powerful about what you were describing about therapy is you do have to be ready for that, because you're going to have disappointments. There will be people who behave really badly toward you. We have to be able to bounce back from that. And it's hard. It can be really hard. And good therapy honors that. And some people avoid therapy because they feel like they're going to feel weak. And if the therapy is effective, it's going to be about honoring. No, life is difficult sometimes when people don't treat us well. It's understandable to feel pain. One of the ways of coping is to have that honored, and that helps you get to that point of what you were saying, the gratitude, seeing the positive things in life. We don't ignore the negative things. That doesn't help us. We put them in a different perspective.
Exactly. Like they're going to be there anyway, whether I decide to struggle with it or not. It's still going to be there.
Yeah, that's right. And they don't define you. And the struggles don't define you.
Exactly. I needed to hear that today. Thank you.
You're welcome.
Okay, Dr. Goodwin, this was such a good episode. I'm so happy I had you on, and I'm sure we will have you back on soon enough with another interesting topic that there's just so much that we could talk about. We could talk for hours. So maybe next topic, we will talk about something different and interesting.
I'd love it. And I guess I should say, maybe I didn't say before, the book is on Amazon. So it's easy to find. Saving Face Without Losing Your Mind. And that's where you find it.
Beautiful. I'm going to link it in the show notes. So you guys look in the description of this episode and you'll be able to find the link.
And by the way, a lot of the book is really about what therapy is about. So even if someone is not necessarily planning a cosmetic procedure, it's about the struggles that come up with cosmetic procedures, the self-esteem, uncertainty, change, aging, those kinds of things, which we all experience.
Book club. Let's start a book club. We can talk
Awesome.
about that. We can read this book and talk about it. All right, my girls in the membership, we're going to start a book club, you guys. So let's click on this link. Y'all order this book and I'll see y'all in the group. Thank you, Dr. Goodwin. We'll see you next week.
Thanks, Bobby. It's really nice to talk with you.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code. And don't forget, new episodes every Monday. I'll see you then.